Hi, my name is Linda. I am not a medical professional, and the information in this video is for information only. If you have any worries about your condition, consult your healthcare professional. In this video, I shall explore the treatment of genetic or inherited autoimmune diseases such as lupus. When you develop an autoimmune disease, your immune system, intended to protect your body from infections and other harmful substances, starts to attack its healthy tissues. The diseases associated with this are often lifelong conditions that cause inflammation and pain and can damage parts of your body such as your joints, skin and organs. Lupus, specifically systemic lupus erythematosus, is one of the most common types of autoimmune diseases and has many symptoms from mild to chronic, which can develop into life-threatening. With all other autoimmune diseases, lupus is incurable. But it can be managed by treatments and strategies, so that you can control the flare-ups and improve your quality of life. In this video, I shall explain the understanding of autoimmune diseases, causes and treatments of lupus, and other autoimmune diseases, and much more. But first I shall explore the understanding of autoimmune diseases. Your immune system protects the body from foreign invaders such as viruses and bacteria. It identifies the harmful pathogens and neutralizes them. But when you develop an autoimmune disease, the process goes wrong and the immune system attacks the body's own cells and tissues. There are more than 80 autoimmune diseases, including lupus, rheumatoid arthritis, multiple sclerosis, and type 1 diabetes. These diseases can attack various organs and tissues, which can include your skin, joints, muscles, blood vessels, and internal organs. Research into autoimmune diseases is not fully understood, but they believe it results from a mixture of genetics, environmental, and hormonal factors. When you develop lupus, it could cause inflammation and can damage multiple organs, including the skin, joints, kidneys, heart, lungs, and brain. The common type of lupus is systemic lupus erythematosus, or SLE, which affects multiple systems throughout the body. Other forms of lupus include cutaneous lupus erythematosus. This affects only the skin and causes rashes, lesions, and other skin problems. Drug-induced lupus is another. It caused by certain medications and mimics the symptoms of systemic lupus erythematosus, but this one can be resolved once the medication is stopped. And another is neonatal lupus. This last one is a rare condition that affects your little infants born to mothers with lupus. It can cause skin rashes, liver problems, and heart issues, but usually resolves within a few months. The symptoms can vary widely from person to person. Some of the common symptoms include fatigue, joint pain and swelling, skin rashes, sensitivity to sunlight, fever, hair loss, and much more. Lupus mainly have periods of flare-ups, where the symptoms worsen, and then periods of remission, where symptoms subside. Research thinks that autoimmune diseases are not fully understood, but they think the cause of the disease is a combination of the following. Number 1. Genetics. If you have a family history of autoimmune disease, it can increase your risk of developing one type. You have many genes in your body, but the most specific gene is involved in your immune system, which is linked to autoimmune diseases. However, they have found that genetics alone do not regulate if someone will develop an autoimmune disease. The environmental factors also play a part. Number 2. Environmental triggers. Various environmental factors can trigger or worsen autoimmune diseases in vulnerable people. The causes may include infections, exposure to ultraviolet UV light, certain medications, smoking, and exposure to environmental toxins. Number 3. Hormones. Autoimmune diseases are more common in women than in men. This suggests that hormones, particularly estrogen, could play a role in their development. Lupus, for example, is most likely to be diagnosed in women of childbearing age, and hormonal fluctuations, such as those that occur during pregnancy, can trigger flare-ups. The treatment for autoimmune diseases often includes a combination of medications, depending on the person's symptoms, disease severity, and overall health. The common medications used include: Number 1. Nonsteroidal anti-inflammatory drugs, such as ibuprofen and naproxen, are commonly used to reduce pain, inflammation, and fever. These can help manage joint pain and mild inflammation, but are generally not sufficient for treating more severe symptoms or organ involvement. Number 2. Antimalarial drugs, such as hydroxychloroquine, Plaquenil, are commonly used to reduce disease activity, prevent flare-ups, and improve long-term outcomes. These drugs work by modulating the immune system and reducing inflammation. Hydroxychloroquine is particularly effective for treating skin and joint symptoms and helps protect against organ damage. Number 3. Corticosteroids. These could be prednisone, which are powerful anti-inflammatory drugs that are used to help moderate to severe symptoms. They can quickly reduce inflammation and control disease activity. However, long-term use of corticosteroids can lead to significant side effects, such as weight gain, high blood pressure, osteoporosis, and an increased risk of infections. Therefore, corticosteroids are usually used at the lowest effective dose for the shortest possible time. Number 4. Immunosuppressants, such as azathioprine or Imuran, mycophenolate mofetil and methotrexate, are used to suppress the immune system and reduce the overactive immune response in the autoimmune disease. These medications are often prescribed for you if you have severe symptoms, particularly when there is organ involvement, which includes kidney inflammation called lupus nephritis. Number 5. Biological drugs like belimumab and rituximab are the newest treatments that target specific parts of the immune system. Belimumab, for example, targets a protein called B lymphocyte stimulator. By reducing the activity of the B cells, belimumab can help reduce symptoms of the disease and help prevent flare-ups. Biologics are reserved for people who have moderate to severe symptoms that do not respond well to other treatments. In addition to your medications, there are various other treatments and lifestyle changes that can help manage your lupus and improve your quality of life. These include: Number 1. Physical therapy helps you to keep your joints flexible, improve mobility, and reduce pain. A physical therapist can design an exercise program tailored to your needs, focusing on low-impact activities that minimize stress on the joints. They can include walking, swimming, and water aerobics are just a few. Number 2. Lifestyle modifications can make certain lifestyle changes and can help reduce flare-ups and improve overall health. These changes may include: sun protection. When you develop lupus, you may become sensitive to sunlight and exposure to UV light that can trigger flare-ups. You should wear sunscreen and protective clothing and avoid prolonged sun exposure. Healthy diet. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help your overall health, reduce inflammation, and keep your weight down. It would help if you go on an anti-inflammatory diet that limits processed foods, sugar, and unhealthy fats. Stress management. Stress can worsen the symptoms, so finding ways to manage stress is important. You could do meditation, deep breathing exercises, and yoga can help reduce stress levels. Regular exercise. Doing regular physical activity can help reduce inflammation, improve your mood, and maintain joint flexibility. Adequate rest. Having adequate rest is vital with your symptoms as you could become fatigued. Getting enough rest is crucial for managing the condition. Making sure you get adequate sleep and taking breaks throughout the day can help prevent fatigue and improve energy levels. While there is currently no cure for autoimmune diseases like lupus, ongoing research on the conditions is leading to the development of new treatments and therapies. Scientists are exploring various approaches to control the immune system, reduce inflammation, and prevent organ damage. They include stem cell therapy, which looks promising for certain autoimmune diseases. This therapy involves using stem cells to reset the immune system and stop the autoimmune attack on the body's tissues. However, stem cell therapy is still considered experimental and more research is needed to determine the safety and long-term effectiveness of this approach for treating autoimmune diseases. Another therapy is targeted therapy. This is designed to specifically target components of the immune system. These therapies can reduce disease activity while minimizing the side effects. There is ongoing research that is focusing on identifying new molecular targets and developing therapies that can more exactly modulate the immune system without causing widespread immunosuppression. Gene therapy is another. This approach involves modifying your genes to correct the underlying genetic mutations that contribute to the autoimmune response. This therapy is still in its early stages of development. The gut microbiome, which consists of trillions of microorganisms, lives in the digestive tract and plays a crucial role in regulating the immune system. The imbalances in the gut microbiome have been linked to the development of autoimmune diseases. Research into microbiome-based therapies is exploring ways to restore a healthy balance of gut bacteria and improve immune system function. This may involve the use of probiotics, prebiotics, or fecal microbiota transplantation to introduce beneficial bacteria into the gut. When you develop any type of autoimmune disease like lupus or rheumatoid arthritis, they are chronic conditions that result from an overactive immune system that attacks the body's own tissues. While there is no known cure, various treatments are available to manage symptoms, reduce inflammation, and prevent organ damage. Prescription medications play a central role in managing the symptoms. In addition to the medication, you should have lifestyle changes, such as maintaining a healthy diet, managing stress, and protecting against sun exposure, which can help your condition and improve your quality of life. As research into the underlying mechanisms of autoimmune diseases continues to advance, new treatments and potential cures may emerge, offering hope for individuals living with autoimmune conditions. Thanks for listening to my video. If you found this video helpful, then please click the subscribe button to follow my channel and press the bell. If you have any questions, please leave a comment below and I will get back to you. I hope this video has helped and good luck.